Good afternoon. Today I'm going to be talking to you about Guillain Barré syndrome. This presentation is coming from the Neurorehabilitation Department of Regional Stroke and Neuroscience Hospital located in Mborichi town in Imo State, Nigeria. What is Guillain Barré syndrome? Guillain Barré syndrome is a rare autoimmune disorder in which the body's immune system attacks heavy nerve cells in the peripheral nervous system. Typically, the peripheral nerves are covered by a sheet of protein referred to as myelin sheet. The myelin sheet helps transmission of nerve information along the peripheral nerves faster. When these are destroyed by the body's immune system, it is referred to as demyelination. When this happens in this condition, it is referred to as acute inflammatory demyelinating polyneuropathy, otherwise known as Guillain Barré syndrome. Causes. The exact cause is unknown. However, we know that about 60% of patients who have Guillain Barré syndrome typically develop it as soon as they fall sick from an infectious cause. This is commonly seen when people have had some viral infection or even viruses that cause the common cold. They can also be seen in some bacterial infections. In a lot of situations, we may not know the reason why this happened. Guillain Barré syndrome tends to affect mainly adult males more than females, and can rarely develop after a patient has received vaccination. Symptoms. The onset on symptoms arise about 2 weeks to 4 weeks following a relatively mild acute infection, such as gastrointestinal or respiratory illness. Because there is demyelination, nerve information does not travel along the nerves as quickly as it's supposed to. The patient may complain of tingling and decreased sensation, typically arising first in the toes and gradually climbing to the ankle, to the knee, and may affect the waist and go up to the upper extremities such as the fingers. As the tingling and decrease in sensation happens, it results also in muscle weakness, which also travel in the same pathway from the legs up. As a result of this, we refer to this as an ascending polyneuropathy, meaning that it comes from the legs and goes up. If the condition continues, the patient may experience weakness of the muscle, loss of balance while walking. They may also experience difficulty with breathing, decrease in their facial movement, and a rapid heartbeat. If the difficulty in breathing continues, the patient may need to be put on a life support machine called a mechanical ventilator and be treated in an intensive care unit. Diagnosis. How is this condition diagnosed? It is very important to diagnose this condition as soon as possible, because if you do not, the weakness and numbness can travel very quickly and involve the muscles of breathing, such that the patient can become unable to breathe. When this happens outside a hospital setting, the patient can die because they are unable to breathe on their own. It is even more challenging because the symptoms of Guillain Barré syndrome can be very similar to other disease conditions such as botulism, myasthenia gravis, poliomyelitis. Because they resemble some of these conditions, it can make it difficult to diagnose. However, once you experience symptoms that are similar to the ones described, it is important for you to see your doctor, especially one who is skilled in neurological sciences, typically called a neurologist. Your doctor will examine you. They may also do what is referred to as spinal tap or lumbar puncture to obtain fluid that runs around your spine and around your brain, called the cerebrospinal fluid. A doctor may also choose to do further studies referred to as electromyography and nerve conduction velocity study to look at how fast information is traveling along your peripheral nerves. Because Guillain Barré syndrome slows the rate at which information travels along your peripheral nerves. The doctor can be able to dictate this slowing when they perform the nerve conduction velocity study. Depending on what is going on, they may have to do other studies such as a CT scan or an MRI. How is this condition treated? Once you have been diagnosed with Guillain Barré syndrome, there are several ways to treat you. One of the ways is to attempt to neutralize the antibodies that your body is producing that is destroying the myelin sheath. This can be done by injection of immunoglobulins. This is typically given through the neck, through the veins over several days. Other methods of treating include also plasmapheresis, which involves the removal of the blood from the body of the patient who is affected, extraction of the red cells and white cells, and then washing away of the plasma. At the end, the blood is returned back to the patient. These treatments are typically offered in specialized centers. Long-term outcomes. If treatment is started quickly enough, the patient is expected to make good recovery. However, in some patients, recovery may take as little as only a few weeks or as long as several years. About 3% of these patients may suffer from relapse of the tingling for several years after the initial attack. However, it is important to recognize that when you're having any of these symptoms described, to see a doctor, we recommend that you see a doctor who's skilled in the diagnosis and the management of neurological conditions. Thank you for listening.